I'm Dr. Kelvin, and in this video, you're going to learn how to get rid of that unbearable pain you have once and for all in your heel caused by plantar fasciitis or heel spur. And the main problem with plantar fasciitis is the wrong treatment that people end up going through. Some doctors prescribe painkillers, anti-inflammatories, or injections. All of that just causes side effects, and when the effect of those medications wears off, the pain comes back, and it comes back twice as bad. Some others want to put the patient through a fasciotomy, where they cut the plantar fascia, and if you're lucky, the pain might get better. But not in 100% of cases does the pain improve. Others prescribe insoles for plantar fasciitis, which do help. Many times I even recommend using insoles. But look, pay attention. If you don't treat the main component, pain from plantar fasciitis, it won't go away. So, for you to cure plantar fasciitis or heel spurs, to get rid of that pain once and for all, actually, the solution is much easier. You don't need to treat the pain. Check out, you're not going to treat pain from the problem with medication, anti-inflammatories, or injections. You don't treat the pain, you investigate the cause and treat the cause. And many times, the cause of this plantar fasciitis is muscle shortening of the thigh muscles. Back here, the calf, and this goes all the way to the plantar fascia, and we don't treat that with medication. We treat it with stretching because medication doesn't stretch anything. It might sound silly because it's so simple, but in the vast majority of cases, just stretching and ice packs, I'm going to teach you all of this in this video, are enough to treat plantar fasciitis without the need for medication, injections, surgeries, etc. I've already recorded another video before with tips and techniques similar to the exercises I'm going to teach you here, but this video is updated. But speaking of the previous video I recorded about plantar fasciitis, check out the comments from people who have already benefited from these exercises that you're going to learn today. One subscriber shared here that, thanks to these tips, he no longer needs to take anti-inflammatories. 2 others said they couldn't even put their foot on the ground anymore. These exercises made all the difference. One subscriber wrote here that his wife has been dealing with a heel spur and plantar fasciitis for months, but thank God he found this video. These 2 subscribers did the bottle exercise. I'm going to teach you the so-called bottle exercise to cure plantar fasciitis. So, stay until the end of this video to find out what the exercise is and why it's so good for foot pain. And these 2 subscribers finally said that that free video helped more than a consultation and treatment with other professionals. So, if you want to benefit from these results, with these alternatives, simple exercises you can do at home to improve or cure plantar fasciitis and heel spurs, watch this video and don't forget to help me out, just like I'm helping you. How do you do that? Leave a like, subscribe to the channel, and share this video with as many people as possible. When you do that, you support my work here on the internet, so I can keep making more and more videos for you. Deal? And the first exercise you're going to do in the morning, before you get out of bed. Remember I said you need to stretch the back part of your legs. For plantar fasciitis, a morning stretch is what you'll do right when you wake up, before your feet touch the floor. Some patients have already asked me, "Doctor, are you going crazy? Why are you giving me leg exercises if my pain is in my foot? What do the leg muscles have to do with my plantar fasciitis?" That makes no sense. But look, everything in our body is connected. Your plantar fascia is connected to your calf, which is connected to the muscles in the back of your thigh, all through a chain that goes up to the back of your head. So, tension in any of those structures I just mentioned to you will affect the plantar fascia. It will be transferred to the plantar fascia since everything is connected. And you know that pain you feel in your feet when you step on the floor in the morning? This stretch I'm about to show you will help prevent that pain, or at least reduce the pain you feel. You might still feel it, but it will be less than if you hadn't done the stretch. So, check out this morning stretch. The first thing you do before getting out of bed, pay attention to the exercise. For this, you'll need a belt, a rope, or something similar. And you need to keep it within reach on your bed so you don't have to get up to grab it. Now, stretch your calf and the muscles at the back of your thigh. That whole pathway I explained earlier, this is the pathway you're stretching. And for this exercise, it's important that you fully extend your knee and lift your heel toward the ceiling, with your big toe pointing toward the tip of your nose. You can do this stretch in 3 sets of 40 seconds for each leg. Exercise number 2. For the second exercise, you're going to need a spoon. You'll use this spoon to do a myofascial release on your plantar fascia, releasing all that tension underneath your feet, kind of like a massage. When the plantar fascia gets stiff from everyday tension, it makes the inflammation worse. It makes the pain worse. It makes plantar fasciitis worse. And if you have a heel spur, it will also make the heel spur worse. So, check this out. You're going to use this spoon to get rid of that tension in your plantar fascia. To release that stiffness you have under your feet, the spoon should have rounded edges, so you don't hurt your foot. And you're also going to need a cream. In this case, I'm using an arnica cream, which has analgesic and anti-inflammatory components. Now, spread the cream over your feet, because besides the analgesic and anti-inflammatory properties for arnica cream, it will allow me to glide the spoon over my feet. So, I take this spoon and perform this myofascial release, gliding the spoon over the plantar fascia, covering the entire area of the sole of the foot, slowly and, of course, applying a certain amount of pressure. The amount of pressure you apply depends on your pain level. The more pressure you use, the deeper the technique goes. If you're able to do the myofascial release with more pressure, and you don't feel pain or hurt yourself, you can go ahead, increasing the amount of pressure you apply with your hand on the spoon. So, you glide from the heel to the big toe, then go back to the heel, move up to the second toe, and return. Slowly work your way up to the third toe, then the fourth and fifth toes. And you should do this myofascial release technique every day, for at least 5 minutes each time. By doing this, you'll relieve the tension in your plantar fascia, and this will help improve the symptoms of plantar fasciitis. Another key component in improving plantar fasciitis is to use compresses, not heat compresses, because heat makes plantar fasciitis and heel spurs worse. The compress you need to use is an ice compress. That's because plantar fasciitis is an inflammation. So, there's an inflammatory process happening under your feet. One of the classic signs of inflammation is heat and increased temperature. If you use a hot compress there, it will just make everything worse. So, use ice compresses, because that really will help reduce the inflammation by lowering the temperature. Besides that, ice also has pain-relieving properties, so it will also help reduce your pain, improving your plantar fasciitis. So, check this out. For this, you need to set aside a water bottle in the freezer, and when that water turns to ice, you're going to sit in a chair or on your couch and lay a towel out in front of you with the bottle on top of it. And now, with your feet on top of the bottle, you're going to move them back and forth. You're going to count 6 seconds as you go forward. So, 1, 2, 3, 4, 5, 6. And then you'll bring your feet back, sliding them over the bottle for another 6 seconds. 5, 4, 3, 2, 1. Do this back and forth movement for 5 minutes. And after that, you're going to take your towel and cover the bottle with this towel. Now, step on the bottle that's covered with the towel and do a compress for 15 minutes. And another key component in treating plantar fasciitis is your diet. There have been some patients who, even with these exercises, didn't get better because they were eating all the wrong things. And when I noticed that, I referred these patients to a nutritionist so that their diet could be changed. Those patients were then able to get rid of their plantar fasciitis. There are some foods that make plantar fasciitis inflammation worse. We call these foods inflammatory enhancers, like, for example, processed foods, which are basically refined flour, sugar, and vegetable fat, which are some of the main culprits for widespread inflammation in your body and are even responsible for plantar fasciitis. Vegetable oil, for example, the kind used in kitchens and restaurants, is truly poison for plantar fasciitis. If you cook with vegetable oil, you should replace it with butter, olive oil, or coconut oil, which are healthier alternatives for cooking. So, pay attention. Your diet is 100% correlated with plantar fasciitis. Those patients who don't get better even with exercises, it's because they're consuming vegetable oil, processed meats, and processed foods. But the good news is that just as they are foods that increase inflammation, and I hope you remove those from your table, there are also foods that act as medicine, foods that heal. So, these foods will take the inflammation out of your body. Along with these exercises, the best example of an anti-inflammatory is omega-3 itself, which is found in foods like tuna, salmon, and sardines. There are also cheaper alternatives, like chia seeds and flaxseed. Omega-3 is a powerful anti-inflammatory that can be taken as a supplement in capsule form or added to your diet. Through these suggestions that I just gave you, combine a good diet with exercise, and you'll notice the pain from plantar fasciitis disappearing. Vitamin D is also a wonderful natural anti-inflammatory. You can supplement with 10,000 international units every day, and you'll see that the pain and inflammation caused by plantar fasciitis, heel spurs, and other problems will go away. And so you don't have to keep taking anti-inflammatories that have various side effects and are harmful to your body. A natural alternative with no side effects is turmeric, also known as curcuma or golden spice. You can take turmeric either in capsule form or as a seasoning, or even use the root itself, since studies show that turmeric has the same anti-inflammatory effects as pharmaceutical anti-inflammatory drugs. However, unlike those pharmacy medications, turmeric doesn't have side effects and can be consumed daily. And finally, the last component, which is also very important in treating plantar fasciitis, is footwear. Remember when I talked about foods and mentioned that there are some you need to avoid, worsen fasciitis, and others you need to eat because they help with plantar fasciitis? It's the same with footwear. Some types of shoes make plantar fasciitis worse, and others I actually prescribe to my patients in the office, so that plantar fasciitis can also be treated through footwear while the patients are walking. The first type of footwear you should avoid are flip-flops and flat sandals. That's because they don't provide the necessary support and stability for your feet, and this can put even more strain on your plantar fascia and your feet, making plantar fasciitis worse over time. Shoes with soft and flexible soles, just like flip-flops and flat sandals, are extremely harmful for plantar fasciitis. Remember this well. The plantar fascia is a membrane of connective tissue that runs from the heel bone all the way to the big toe, forming the plantar arch, which serves to support your feet. When you walk in these shoes with softer soles, you make this motion on the ground with your toes. We call this movement hyperextension. This puts even more strain on the plantar fascia and, therefore, it is extremely harmful for plantar fasciitis. And if someone who wears these types of shoes a lot doesn't have plantar fasciitis yet, this could be the reason they develop it in the future. Another type of shoe that's a villain for plantar fasciitis and heel spurs is the one you're seeing on the screen. But I can't say the name of that brand or I might get sued, right? This type of shoe also lacks support and stability and cushioning for your feet. It also has a very flexible sole, and that's why this shoe is also harmful for plantar fasciitis. Comment below. I'm curious if you've ever worn this type of shoe. And finally, another shoe you should avoid. This one is terrible. It's not just harmful for those of you with plantar fasciitis, but also for people who have other types of foot pain, like bunions, Morton's neuroma, as well as ankle pain, knee pain, and back pain. This shoe is the high heel. High heels not only cause excessive tension in your feet, but they also constantly encourage that movement of hyperextending your toes, causing even more tension in the plantar fascia. On top of that, high heels constantly force you to stay on your tiptoes. In the long run, this causes your calf muscles to shorten. And I already told you that the shortened calf are one of the causes of plantar fasciitis, and that's why I teach you to stretch your calves. But it's not just people who wear high heels who need to stretch their calves. Everyone with plantar fasciitis does, even if you don't wear them. But just like there are shoes that can get in the way of your treatment for plantar fasciitis, there are other shoes that can actually help with your treatment. Not just for plantar fasciitis, but also for heel spurs. These shoes are known as rocker shoes or rolling sneakers, and they avoid this hyperextension movement of the fingers. That's because their soles are stiffer than the others that I explained to you earlier, besides providing support, stability, and proper fit for your feet. Some examples of shoes that I recommend to my patients are Fila, Calzani, the Skechers Max, and the Roca Bond, and I recorded a video explaining what my experience was like with these shoes. Because I also had plantar fasciitis, I used these shoes along with the stretches I showed you in this video, together with the diet I explained in this video, and I quickly treated my plantar fasciitis. If you want to watch the video where I explain my experience with these shoes, just click here. Thank you so much for staying until the end of this video. See you next time.